Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today's guest is Neha Soni-Patel. She is a worker in education as a work leader in the Pediatric Echo Department at Cleveland Clinic Children's Hospital in Cleveland, Ohio, and is an adjunct instructor of pediatric echo at Cuyahoga Community College. She has been a pediatric echo sonographer for 15 years. She graduated from Purdue University in 1997 with a degree in mechanical engineering. After she sent her 3 children off to school, Neha went back to school and pursued echocardiography in 2011. She has since earned her master's degree in education for health professions, education from Cleveland State University in 2019. She volunteers extensively for ASE, SDMS, CCI, SOPE, ACC, and is part of Cardiovascular Allied Health Work Group and was the previous president of the Northern Ohio Cardiac Imaging Association. This year, Neha will be moving into the chair position at the American Society of Echocardiographer Sonographer Council. If she has spare time, she loves movies, tormenting her now almost adult children, and trying to be crafty, maybe organizing her house and hanging out by the bonfire with friends. Please help me welcome Neha Soni-Patel. Thank you, Neha, for joining us today. I'm super excited about having Soni on. I'm sorry, Neha, right?
Yeah.
Neha
We're gonna
on
like go.
today. I first heard Neha at an SDMS conference last year, and I was so inspired by her talk. And she joined 2 topics together that are near and dear to my heart, and I think near and dear to a lot of people's heart. And so I thought it would be good to share with everybody on the podcast. So thank you for joining us today.
Thank you, Debbie, for having me. I'm very happy to be here.
So, first of all, before we start into our topic of Breaking the Gates, a guide to career development and self-care, tell us a little bit about why and how you got into ultrasound.
Ooh. It's funny how life leads you in certain directions and you don't know where you're going. Sometimes you think your life's been put into a blender and someone hit puree, and that's kind of where I was at. I actually have a background in mechanical engineering, so was had moved out to Cleveland, Ohio at the time when all the companies were going bust. It was just a bad time in the economy, but it happened to be the right time. I had 3 children, and so I was able to stay home with them. And just as they were getting ready to, or the last one was getting ready to go off to kindergarten, I knew that there was something else I wanted to do. And not really sure how, maybe someone mentioned ultrasound, and I thought, okay, I'll do that. It'll be a nice gig, so I can take care of the kids and do this. I had no idea what I was getting into. And lo and behold, my initial plan was to work part-time in a cardiologist office, and now I'm working full-time at a children's hospital, a high acuity center. So it has become an incredible passion just to figure out just to see where I was and to figure out where I was going and where life led me. Sometimes you just have to hold on and just say, let's go and see where the train takes you.
Yeah, I love it. Following your joy or what piques your interest, right? I think
Mhm.
that's the start of everything really great. So I love your story because you started in one industry and you switched to this industry. And so I think we all have different backgrounds and we come to this with from different ways, right? Of finding things out.
Mhm.
And I think it um it brings a lot of depth to our community, that you had previous professional experience, and yet now you chose this as a profession. So thanks for joining our community and being a part of it and contributing so well to all that you do.
Oh, so
So,
happy to be here. Best decision of my
best
life.
decision. Yeah. Yeah. And why do you say that? Why do you say it was the best decision?
I think because I've been able to be more impactful, and I'm specifically in pediatric echo, so I didn't know it was a newer field 15 years ago, while it had been going on for a while. Just a lot of the innovations, a lot of the structure has been developed in the last 15, 20 years, and I was able to be a part of that and been able to see the changes, what's happened in just this short amount of time.
Awesome. Yeah. I'm glad that you can see the changes in 15 years. I've been a part of it for 30 years, had that privilege, and yeah, the changes I've seen are super I don't know, it just gives me a lot of hope, right?
Yeah.
That things can change, and there were people who went before me who kind of precipitated and encouraged and did the work to make that change. And so this is one reason why I'm doing the podcast, is because I want to be a part of the change. I want to be a part of educating and bringing our community together, and being the change for the people who are coming under us, for lack of a better word.
Right.
So thanks for being a part. Um, so tell us a little bit. We're going to try to walk through her presentation she gave at SDMS a little bit. And she kind of starts out with talking about scanning smarter, not harder. And so tell us a little bit about the statistics behind ergonomics, a little bit that you shared.
Yeah, well, it's interesting. And, in my house, my husband's a huge football fan. So I actually had started off with a football analogy about a football player who had been in the game for 40 years. And you don't really hear that too much these days. And I started looking into the stats of that and found out that pretty much they have about a 3.5 year life cycle in football. And what knocks them out? Injuries. And so I'm also a part of SDMS, and they also look at musculoskeletal injuries and how much they've it's pretty much invaded the entire sonography realm. And about 90% of sonographers experience some sort of musculoskeletal injury or disorder throughout their lifespan. And 20% of them will end up having a or not life ending, sorry, career ending injury. And so we want to try to figure out what can we do? What can we do to change that? How can we change the way we scan, how we scan? And we know we're fighting an uphill battle. Healthcare, we're trying to get a lot of patients through the door. More patients mean more scanning. Well, how many more echoes can we do in the day? According to guidelines, our echoes should be 45 minutes. And for pediatric echo, we can have up to an hour, especially on our non-complex cases. Forget about the kids that are moving targets.
Right, right.
But we have echoes scheduled every half an hour in many of these locations. Sonographers are expected to scan between 8 to 10 adult echoes per day. We know that the population's getting larger and bigger, and we just don't know how we can make ends meet. Our sonographers are leaving because they're getting hurt, but then our populations are increasing both in numbers and in size. So now we have to figure out what can we do to meet in the middle? What can we do to scan smarter, but not harder, but still get the job done in the end?
Yeah, I think, like you said, it's an ever evolving issue, right? We can talk about this till the days, turn blue, it's just always going to be there, I think. Um, and I commend STMS. I think at our last conference, they brought an occupational therapist in and some other specialties to really hone in on, yes, now we have the data. Now, what do we do with the data in order to keep us from being injured? So, because we have societies like SDMS, we can kind of slowly move forward with that research to help us. So, I'm extremely grateful for SDMS who can bring that together, and bring great ideas together. So, one of your slides, you talk about, because your specialty is pediatric echo, right? You have
Mhm.
different challenges than adult echo or abdominal, or even just pediatrics in general is
Mhm.
very different than general work or
Right.
OB. So, one of the struggles that I think you're faced with that you mentioned in your slides are that your people press too hard, which is
Right.
very opposite most modalities, right? Most
Right.
modalities were like push harder, push harder. But yet in pediatrics, I thought this was interesting. Your uh, had many instances where people were pressing too hard, right?
Right.
Tell us more
Right.
about that.
A lot of the people that come into our lab and come start training in our lab, they'll come from the adult world. And I really do say that before you come into peds, you need to be a stellar adult sonographer. Now, being stellar doesn't mean performing more echoes. It's understanding the anatomy, understanding your machine. But the second we have to go scan for that IVC, the first thing we do is we start building up our arm and we just push. And I remember telling that sonographer, now, usually when everyone comes in to train, they are not given children. They are not given babies. We give them the 18, 19-year-old football players that come in, and we give them the adult-sized patients. And the first thing they do is press. And I said, don't press so hard. She would not believe me. And so I finally just said, okay, I'm going to grab this picture. And I held the probe by the wire and just rested the probe on the gel on the patient's body. And you saw the IVC open up. And I said, if you press too hard, you're going to compress the IVC. So the first place they go when they think about I'm not getting the pictures, they start to press harder. I say, make sure you have enough gel, make sure you're in the correct location, and make sure you're not compressing the anatomy that you're trying to look for. And just that one image, and of course, there's other image optimization tools we can use on the machine, but before you press hard, there are 20 steps you can do before you finally say, okay, I need to press harder.
Yeah, I thought that was interesting because that's not something I think of very often when
Mhm.
doing adult general or OB or adult echo, even for that matter, right? And that's where our injuries come from many times is
Right.
pushing hard, right?
Hmm.
So you also shared an image of a couple images of just clicking a picture and comparing it to a diagnostic image. So can
Hmm.
you walk us through that a little bit?
Well, it's actually a weird thing. I'm an educator at heart. So I ended up taking a picture, and as I was flying home, it was in New Orleans, and as I was flying home, it just dawned on me, wait, this was a teaching moment. And what it was is my husband and I, we were walking down Bourbon Street and all the art galleries we could see through the windows. And there was a really cool picture that I took or that I saw, and I took a picture of it through my phone and I was looking at it on the plane, and it just didn't capture what it was that I wanted to see. So I went back home and I said, you know what? That was a great teaching image. So I looked at all my Google photos. I saw the picture before and the picture after, went on Google Maps and found the art gallery where I took this picture. I called the art gallery and I asked the guy there, are you the owner? And he says, yes, I am. I said, you have a picture in your window. Can you take a picture of it for me and send it to me? And I explained to him that I'm an instructor and it's a great image for me to teach from. And he's like, okay. So he sends me the picture. And as all educators do, I said, can you go back in and take another picture? But I need you to move a little bit in front of it. And I want you to hone in on the little ice cream cart that's right there in the center. And he was like, okay. And he went back, sent me the picture. But we're all used to that, right? When we take
Right.
pictures in our lab, our doc says, "Hey, can you go back and get another picture?" So I just thought it was very funny that he did that for me. And the picture that I took, if I were to zoom in on that one little area, this little ice cream cart, it was all very blurry. And you couldn't really see the detail that I was appreciating when I was there in person. Now, the picture that he sent me, he took it with a high resolution phone camera. He zoomed in on it. He was close to it. And you can actually see that it wasn't just a painting. The features on the painting itself were droplets of paint that were three-dimensional. And so the picture that he sent me, I was able to show that these are three-dimensional images, not just a quick 2D blurry picture. And this is what we get used to. This is a lot of times when I get brand new sonographers coming into our lab or someone who's been scanning a very long time in a place where they're just on autopilot, that they just clip and go, clip and go, clip and go without taking that moment to optimize. And those two pictures, my blurry picture compared to his beautiful picture, really tell you what the difference is between a tech and a sonographer. What's the difference between a non-diagnostic and a diagnostic image? So I use that as an example all the time now when people are trying to say, "Oh, but I don't know what else can I do differently. I don't see the difference." And I say, "I'll show you the difference. Here are the image optimization tools we can use to make your picture better."
Yeah, I love that. I love that analogy because it's so true, right? I love going through art galleries and going through museums and different things as I've traveled, and sometimes I take pictures of things and I'm like, it's just not as good as it was when I was there. I didn't capture the detail that I wanted, right? And so I've thought of that often, you know. But you also shared a slide that said it's fine, right? And I loved that slide because I thought, not only do I hear it from like my daughter or other people, coworkers, how are you doing today? I'm fine, like, they're not really fine, right? And so tell
Right.
me, your experience with it's fine.
Well, as a work leader in the lab, at some point you will have group members that'll question, "Okay, why are you being so picky? The doctor said it's fine. Why are you being picky?" And I said, "You know what? My job starts when you take that first picture and it stops when you finish the report. I am fully responsible for everything that you do. Then you are just handing the baton over to the doctor so that they can medically manage that patient. Now, if you go in on a busy day and they're reviewing your images, and that's what happens in Peds Echo, we're not just doing the echo and then the doc's reading it at the end of the day. We actually, before we let the patient go, we have our pictures reviewed. Now, if it's a busy day, the doc may just be like flipping through your pictures and go, "It's fine." Just, and I always tell the sonographers, when you see them like kind of nod their head and wave you off, kind of like "it's fine," be careful. Take a look at your pictures. Is it really fine? Did you optimize the images that was needed, or did you just get those quick clip and go kind of pictures? And that's why my job will end where I look through all the pictures and I say, this picture could have been optimized. You're off axis. These measurements, you've made them, but the original image is not on axis. And so I don't know if we can say that that's the correct measurement. So of course people will get mad and not mad, but it hurts to get
Frustrated.
feedback. Yeah.
Frustrated. Yeah.
They're frustrated too. There's a lot of words that go through their mouths when they're
Or
getting feedback like
disappointed.
that.
I think sometimes I get disappointed because, like,
Yeah.
when I took that picture, I didn't remember it being like that, right? And so it's like,
Oh,
what happened
yeah.
there, right? Yeah.
Yeah. So much. And and it depends too. If someone's been scanning for 20 years and then they decide to join our lab, there's a whole new set of rules and ideas and just methods that you haven't been taught. And adult sonographers who come into the PED lab, they go through many, many emotions. And the first is like, "What are you saying? My picture isn't good enough." And then, "Oh, why didn't anyone tell me this before?" And then they get to this point where they go, "Oh my gosh, I've scanned so many of these in my lifetime. What did I miss?" And
Right.
when they get to that point, then you're like, okay, they are in. They
Yeah.
truly get it. They want to do better. And that's what I look for when our sonographers come in.
Yeah. I love it. And I love when you talk about you had like a balancing beam with confidence on one side and humility on the other. And I loved that analogy as well. Can you speak to that for me?
Right, it's tough to get feedback when you're at the top of your game leaving another lab and you go into a new realm where methods are different, procedures are different, but also basic information that you thought you knew is actually different, especially from adult to pediatrics. And we have people who have come in very, very confident that they knew what they were doing, and we have no doubt that they were stellar adult sonographers. But then there's also that part to remain humble, that even though someone who may have only been in peds for 3 years, and maybe have only been scanning for 3 years, may have more information than you've had in the 10 years you were scanning in another lab. It's just being open to any kind of feedback. Are there things that I'm learning, just yesterday? Of course, but it's to know that you're not going to know everything that's out there. But if you work as that team, there's going to be someone there who knows something. So it's better to seek out the knowledge than become that gatekeeper of all knowledge. And that's why this is about breaking the gates, right? We don't want to gatekeep any information. We want it all to be out there. We want everyone to understand the tools of optimization and how to make things better. And it's always, if always search out the smarter person in the room. If you think you're the smarter person in the room, then you're in the wrong room. Go
Right.
find a room where there's someone else who's smarter than you so that you can continue to learn.
Yes. Yes, absolutely. I love that. Recently I've started a new position. So I'm in the period of transition, right? And so I'm not learning new things, I'm just learning their way of doing things, right? And
Right.
so it's an adjustment. And even though I have a lot of confidence in what I do, I have to show a lot of humility, right? And so there's a whole bunch of emotions. And I thought, this is so interesting. I'm so glad I'm going through this experience. Not that it's easy, but um, I'm having all my emotions, right? And but the person training me also has a bunch of emotions, right? Um, so it was interesting because there was a little bit of a miscommunication, and I'm like, time out. This isn't personal. I know what you're sharing with me is not personal, right? Like, I don't take it personally. I know that this is what this lab wants, and you're the
Yeah.
person delivering that information to me. So none of this is personal. And I went on to say, I appreciate your thoroughness, your detail, your consistency, your I listed like multiple things that she did very well with training me. And all of a sudden the energy shifts, right? Between her and
Right.
I. It's not we're against each other, but we're in this together, right?
Right. Right.
Um, and
And
so I appreciated that moment because it was a real teaching moment because she was feeling a certain way and taking things a little bit personal. And I'm like, time out. This is not personal. This is not about you. This is, you're teaching me the standards of this lab. I got it. You know? So
yeah.
it's important
And
to have that
sometimes
communication.
Yeah, sometimes the best teachers are actually the newer sonographers that join the lab. Because if you're being taught by someone who's been there for 10, 15 years, they know what the procedures are, the workflow is, and how to do certain views and get certain images. But that new sonographer who may be a student, maybe in their 20s, may have only been scanning for 2, 3 years, but they remember what they didn't know. And
Right.
it's very easy for them to then communicate that to the new person being trained, no matter how much experience that other sonographer has. So
Right.
we do have to let the new trainees know that, hey, you're going to be trained by someone who's had less experience in the field than you, totally. But they've been in our lab. So we are going to pair you guys together because we want you to learn those things that we may have forgotten how to train you on.
Right. Right. I think that's a great uh lesson to learn. Recently, I've joined a advanced practice sonography program, and we're in with cardiology, vascular, and OB technologists. We're all in the training together. Now we have our breakouts for our own specialties, but it's fascinating to be in the same room learning some of the same things together because everybody brings a different thing, right? And
Right.
it's just a great way to bring unity in the ultrasound community, and learning everybody has value, right?
Yeah.
Whether you lots of experience or not a lot of experience, or, you know, I'm still 30 years still learning a huge amount of things, smaller, not the bigger concepts, very small, minute on a granular kind of scale, but um it's important that we can learn from the young people who are just coming in, um, as well as from those who've been doing it for a long time. So
Right. Right.
I think that's a part of the humility, right? That
Mhm.
that we need. So tell us about the tools for optimization. Not only is this applicable, I found, with pediatric cardiology, but in other fields as well. So can you share?
Yeah, when you first go in and you start learning about your machines, you have one probe as in the adult world. Now in peds we have three, sometimes if we're lucky we'll have four. But usually there's that one probe, and it's difficult to think that, okay, with one probe, we should be able to scan the ballerina versus the football player. They're both going to be considered adults, but there's going to be very different types of obstacles along the way. We may actually get better pictures with the football player because the ballerina's rib spaces are so small. But understanding the basic physics, I know it's a naughty word, physics, but it really is. The larger the patient, the lower the frequency probe. So if you have a smaller patient, know that on your machine, you can turn up the frequency of your probe. Those of you that use the Philips application or Philips platform know that pen, gen, and res. Pen means penetration. And if you actually look at the numbers on the screen, you'll see that the frequency of the probe decreases when you're trying to scan that larger patient to penetrate. Whereas an opposite, when you're saying resolution, you want the resolution between the structures, and that's going to be a higher frequency. And you're going to be able to get that kind of definition of the more shallow structures. So understanding that probe selection is not just picking the probe, but it's also making the adjustments within the probe, either your frequency, the compression, and understanding that Nyquist limits shouldn't necessarily just be set at the same number throughout the entire echo. So now we're going past the probe. You're looking at your frequency. You're looking at compression. Don't make all the black, white, grays disappear. It doesn't need to be a very black, white picture because you need to see the tissue. But looking at color scales, knowing that to look for TR, maybe decrease your Nyquist limit to get it down to the 60s. But if you have high, vibrant flow, you don't need 60s when looking at the aortic valve. It's okay to bump it up a little bit. Because in the end, if everything looks like it's yellow and orange, everything's going to look like it's obstructive. You want to show what's really there. And so for us, we can have our scales up to the 80s and 90s for the aortic valve and down to the 50s and 60s for the tricuspid valve. When we're looking at the pulmonary veins, we'll bring that down to 30, 40. Coronaries will be between 20 and 40. Sometimes you'll see coronaries hit really higher Nyquist limits, but it's just to know that change all of these controls on your machine to show what it is you want to show on that picture. If you're looking at a pulmonary vein, don't keep your scale up to 70 and 80. Lower it. Let the doctor know that you're actually looking straight on at that pulmonary vein. And if there's anything that sonographers can do before you even look at any of that, know how to center all your images, know how to have on-axis imaging. If you are able to bring in a picture and move it to the center of the screen, then when you see an anomaly in the corner of your eye, you're going to be able to know, your hand is going to be able to know how to move that picture into the center, because we also know that our Doppler signals, our color Doppler has to be parallel to the flow. 2D and our imaging, our angle of inclination needs to be 90 degrees to tissue, but 0 degrees to parallel flow, for color flow. So those angles will really make a difference. And you want to make sure that you have that on-axis imaging, centered images to have good Doppler quality. If you know what image is supposed to be in your window, you get that anatomy in there, then you will actually have a very, very stellar echo.
Yes, I agree. But those are a lot of things that apply to every modality, right? Your
Right.
probe selection, your color scale, according to what you're looking at, right?
Mhm.
The aorta versus the pulmonaries, your angles, different things like that. So that's that's a good checklist. But you also have a checklist while scanning as far as the depth, the frequency for you guys checking the EKG and the scales and the angles and then your gains, right?
Right.
I think
Right.
of when I do fetal echo, um, I do like more contrast in my image. So I change my dynamic range, but I don't change it so drastically that I'm not seeing my soft tissue around it as well. Right.
Mhm.
So I
Right.
um that matters. You also make a point that each picture counts. Can you speak to that?
Well, each picture should make sense. Trying to capture everything in one image doesn't necessarily help you get the picture across what it is you're trying to say. In your echo, if you're looking at an aortic valve, look at your aortic valve, interrogate it completely and fully. And we want to optimize the best we can. And you want to make sure that your picture makes sense. If you're looking at your M mode, make sure the depth is appropriate so you can see a posterior wall. Now, not all of the labs use M mode anymore, especially in the adult world, but in peds, we still do that. And I've had pediatric cardiologists just say, you can pry M mode out of my dying hands, but they'll never let go of it.
Yeah.
We want to make sure that each picture makes sense. Why are you taking the picture? What are you looking at? That's why centering your image both horizontally and vertically on the screen, that's where your eye goes. That's where the physician's eye is going to go. So when I always tell people, if you're showing me something and you're saying, "Oh, look what's up there in the upper left-hand corner," I'm like, "No, I'm looking right there, right in the center of my picture." So if you really want me to look at it, bring it in. Show me what you're doing to bring that in. So make each picture make sense. If you've got your Doppler scales on your Doppler image, if this velocity is 1 meter per second, don't have the scale set to 4. Make each picture make sense. Adjustments, 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 so that we know exactly what you're trying to tell us. We all know, that line, do you understand the words coming out of my mouth? I want to see, do you understand the pictures that are coming out of my probe? You should be able to see, the doctor should be able to see and read the story of this echo before they even look at the report.
Yeah, and you show several images and talk about, excuse me, how to optimize them on, especially with your Dopplers and how many beats and above and below the baseline and different
Mhm.
things like that that are specific. Um, and you gotta, like you said, know your flow, know your anatomy. What does this flow supposed to look like in a normal, right? And how do you optimize
Oh.
that? Often here we're telling a story, right? We're telling the story of the patient and the condition of certain vessels and different things. And so I think it's important to get the best story, right? Get the real truth
Yeah.
of that story. Um, but tell us your definition of diagnostic.
Oh, it's that. It's being able to look at the picture and know what it is you're saying. So making sure, especially with Dopplers, making sure that your signal is clear. Are there three beats in the picture, right? We want to be able to see, is there consistency? Is your gain too high? Is the gain too low? Looking at low velocity reject, that's where it's right at the baseline. And low velocity reject is the same as wall filter on the Philips. It's low velocity reject on the GE machines. You can actually get rid of low flows and very low velocity flows that are within your picture. Now, if you're looking at a structure where flow reversal may be an issue, such as your abdominal aorta, but if your low velocity reject is set too high, you can completely eliminate that signal and not even know that you have that flow reversal. You want to make sure that your signal is measurable with a minimal margin of error. You do that by expanding that Doppler signal. So, like I said, if your scale is set to 4, but your Vmax, you only see it as 1, then change your scale, lower your scale so you see it from 1 to 2. So you can actually measure a VTI of that Doppler signal. Let's say it's of the aortic valve. Um, the best way to check, if you're having trouble with something, if you're having trouble with measuring, have a friend. Hey, you know what? My echo just got read, but how would you measure this picture? How would you measure this Doppler? And have a friend check it out and see if you both agree. Because we are nothing if we are just an island. If you have reproducible pictures, a reproducible method in the lab, then that lab is going to be very successful. We want consistency within the lab. That's how you eliminate errors. And remember, eliminating errors is nothing but patient safety. We know that we are helping the doctor diagnose what's going on with that patient. In peds, it's very important too. You measure an LV too large, then they are now going to be put on a set of medications to help with a dilated ventricle. But the next echo, you realize, whoa, they actually measured it incorrectly in the prior echo. That's why you want to make sure that your measurements are all reproducible. Also looking at it as we have the rule to have 3 consecutive beats that you can measure because respiratory variations are exasperated in younger children. And so we want to make sure that we are getting a good value. And if you can't reproduce that Doppler signal 3 times within that same picture, then that means you need to move your hand. You need to try to figure out how to optimize it. And, M mode should contain all of the features to be able to measure, right? We have to be able to measure uh, how large the LV is getting, how small the LV is getting in diastole, in systole. But looking at your EKG, electrical will come before mechanical. So when you see that electrical QRS complex, don't measure before the QRS complex. You want to take a look, where is that ventricle largest at or after that QRS complex? Making sure you can see both walls, the septal wall or the posterior wall. Attenuation occurs. So by the time you get to the posterior wall, it may be a little bit darker. So use your TGCs. Once you start to recognize what a good picture looks like, you're going to be able to reproduce it for yourself. Your colleagues will see it. You will work on it together. And that's the goal, that everyone starts to scan in a similar fashion so that you cannot tell which sonographer performed that echo.
Yeah, and that's tough because a lot of physicians can really tell who we are by how we're scanning, right? So I think
Right.
that's interesting in and of itself, right? I love what you
Mm,
said in another slide that said, why does it matter that we um optimize our imaging? And you had mentioned earlier that it eliminates or decreases errors and echo time.
mhm.
And you also mentioned about sending to an outside facility, and I think that's something to consider as well. What if someone outside our lab can looks at our imaging? Are they able to tell, right? Are they
Mhm.
able to get a clear image of what we saw that they're going to see? So I think that's important because we do spend a lot of time reviewing previous imaging, right? What do they
Mhm.
see? How did they see it? And can we reproduce that? Or is that exactly what we're seeing or not seeing?
Right. And are you proud of your echo that you've just completed?
Yeah.
And we're all human. We know that when we get an echo from the outside facility, the first thing we'll look at will be, okay, who did it? And, echo's a very, very small world. Pediatric echo, even more so. So
Mhm.
sometimes we will get echoes that come in from outside facilities and we'll go, yeah, we know this sonographer. They're good. If this is what they got, then this is what they got. But then we'll also be like, yeah, we know this sonographer, and I think we're going to be able to optimize these images. So if you also think about that, it's a little bit of the fear factor put in too. What if someone else is going to be picking apart your echo? Could they pick it apart? But in the end, it's about making sure that everyone's giving the attention to quality as opposed to the quantity of echoes. And we want to make sure that if you have the best picture, we can make the best measurements. If you're just clipping and going and we're just measuring just for the sake of measuring, then we're not going to be able to give good diagnostic information from that echo. That's why, in the end, this all matters because it's a matter of patient safety.
I love that. I love that you tie it to patient safety, right? Because that's truly what we're all here for. Um, and quality matters. Quality matters. Um, Talk to me about the bowl of eggs. You have a picture of a bowl of eggs, and most of them white with one brown one in the bowl. Tell us more about that.
That it's a trademark. I think I put that slide in almost all of my presentations that I make because a lot of the things that we see happen when we're paying attention to little blips of color off on the side of the screen and we start to move pictures off axis. We do our protocol, but then we go, how am I going to really interrogate that? And, the eye doesn't see what the mind doesn't know. And if you've seen it, but then finally you go, I need to look for it. You got to go out of protocol. And how many places are stuck with, no, you must do this like this. And then that's it. You must do this like this. And they get stuck in this protocol just so they can move faster, but not realizing that if you just break outside of that box and break out of protocol, you could see so much more. Just like when adult sonographers would say, to look for a left SVC, we always did a bubble study. Why didn't we just look for it? Why don't we just look for the LSVC? And we have the imaging. We teach that to everyone who learns the pediatric protocol. So I use this bowl of white eggs and I say, be the brown egg, be the cage-free sonographer, be the one that breaks out of that box and scans on their own out of protocol so that you can see the other things. Do the pictures they want, of course,
Right.
but be able to scan outside of that and think outside the box.
I love that. I love that. So let's talk about you have quite a few images here that are so funny. Um, One you have almost like a ladder that says, "Oh shit," you know. Um and then a stenographer specialized and then leadership. Can we start talking about maybe the career path side of this
Right.
as well and how quality really
Right.
helps us in our career path?
Yes. A lot of times, and we'll see a lot on these forums when sonographers need to pass their registries and the exams. And once they pass, it's like, yes, I passed the exam. It's to remind everyone that passing the exams, those are the bare minimum to be in the field. There's still so much more that needs to be done. So that's just not the end of your journey. You've hit one pinnacle of one little hill only to find that there's a giant mountain in front of you. But that's your career path. You get hired, you become the staff sonographer, and it's okay to remain there as a staff sonographer. We need soldiers, right? Everyone can't be a general, but we also need the people who just love the work and just want to do the work and go home. And there's this stigma of, oh, they just want to clock in and clock out. I don't find that bad. Are they doing a good job in that time that they're clocked in? That's what I look at. But then after a while, just kind of like how when I was home with my kids, I gotta go do something else. I gotta specialize in something. I've done the domestic engineering. I need to do something else.
Right.
When you've done ultrasound for a while, and you get that 7-year itch where you start to think, okay, what am I gonna do now? Well, all I can do is be a work leader or I can be a manager. But But what else is there? Well, you can specialize. So from adult echo, you can go into pediatric echo, you can go into fetal echo. There's a lot there. You can go into leadership, either as a work leader, the in-house educator, manager, health administration, if you decide to go outside of the clinical lab, research, all of that is out there. But it's the pathway. It's what is it that you want to do? And there's so much more out there other than just leadership. In that, first off, I think the one thing that I tell everyone is make sure that you are always updating your resume. You may stay in the same place that you're at for a very, very long time, and it's okay, but sometimes you forget those little wins. Maybe you developed a new protocol in your department. Maybe you did something to teach the fellows. Those kinds of things you can put in on your resume as things that you've done. And I always encourage people to have someone take a look at that resume just in case. The attention to detail is very important. And once you start training yourself to do it, then when the time comes and there's a door that's open, you'll be ready to walk in. Whether it means getting an advanced degree, getting your bachelor's, getting a master's, which is very, very important. I am a huge proponent of advanced degrees. You'll see a lot of talk about, oh, you don't need anything more than a certificate to do ultrasound. Sure, to get in the door. But then I can promise you in that 5 years when your body starts to have little twinges of pain, you're going to ask yourself, wait a minute, what am I going to do now? Well, in those 5 years, if you're working at a hospital, you can start taking classes to get your bachelor's. You
Right.
can decide on one, but just start taking classes. And before you know it, you'll have that bachelor's degree. And lo and behold, you find out you need to move
Yeah.
and you have enough experience. You have a bachelor's degree now. You didn't know what you were going to do with it, but that new place, what if they say, oh, our work leaders need to have a bachelor's degree? Well,
Mhm.
guess what? You're already ready for that. You've been working for it. You have all the qualifications. You were doing little things in the lab. And now, guess what? In that other hospital that you're going to be moving to, that's actually all the qualifications to be their work leader. So
Right.
be prepared, be ready, have that attention to detail. And there's so much more out there too, just beyond being a work leader and manager. And we can talk about that. It's just we've all seen our application specialists. We've seen people who switch to industry. And while it's great, the hospital loses out on you, right? Because you move to another location but it's pretty lucrative. So, but how much do you want to travel? I mean, it's one of those things where it's a lifestyle change. But there's a lot out there. In terms of what you can do, it's just being ready for it to be able to take that first step. And continuing on your education is very, very important. And have your hospital pay for it.
Yeah. Yeah. I always say education precedes opportunity, right?
Yeah.
So you've got to get the education first before you get the opportunity. And
Hmm.
so I'm a huge proponent of education as well, higher level education. I think it makes us more well-rounded people and gives us a new set of skills. If nothing else, it proves that we've set a goal and we're able to achieve our goal, right?
Hmm.
And we're
Hmm.
able to stick it out to get that goal, right? There's a lot
Right.
to be said for creating a goal, going after it, sticking with it till completion. And so there's a lot to be said for that as well. Um, Putting in the time, right, in order to get
Mhm.
that education.
Right. Right.
So I agree. I think there's a lot of other opportunities, but you've kind of broken down the sonographer level into career, like a career ladder. So can you explain how you kind of broke that down in different levels?
Well, you know what? What's really good, since I've done these talks, the American Society of Echo has put out a career ladder to help labs navigate through this new era where some sonographers are doing more, other sonographers are remaining staff sonographers, but there's that question of what's next? Am I going to get paid more? What can I move to? And so they're trying to go to a tiered system, which is based off of points. What do? You get certain number of points. Now, this is a suggestion from this writing group and from ASE. You can do whatever is needed for your lab. So my thoughts on the career ladder are just basically what I see someone coming in as. You know, you have your categories are based off of experience, self-directed learning. What can you do on your own? What kind of initiatives do you take by yourself? What's your internal motivation? Do you have leadership skills? And do you have a desire to progress and to advance? And do you have a desire to mentor and to take people along with you for that ride? So that level one sonographer is that new grad, the new hire, the one who's just learning how things work in your lab. Your level two is your registered staff sonographer, which majority of us are. And level three is when you start to get your additional registries, when you are maybe going into pediatric echo, you have adult and peds, or your peds and fetal, or if you're in a multimodality lab, if you're doing adult echo and vascular. But it's also when you're giving back to your team too. The things you're learning, are you educating your team? Are you training your team? Are you helping with quality initiatives? Are you helping with safety initiatives? Are you doing something beyond just the scanning and the clinical part of the day? This is where that biggest difference comes in between the level twos and level threes, because we do remember back in the day when someone would be like, well, I've been here for 20 years and I can't believe that this person who's only got 7 years got this opportunity. But did that person who got the opportunity, were they working at it? Were they doing things? Were they educating the lab? Or did they just wait for someone to give them something? And
Mhm.
then you finally have your level four, your leader. They're the ones who can work independently. They don't need to be told what to do. They understand the rules. They understand what needs to be done. And they are able to provide goals that they have developed for themselves. So it all is a movement from being that student, the one where people tell you these are your goals, these are your rubrics, to someone who doesn't need a set of rubrics to succeed. They know what they need to do, they know how to work hard, and they also know how to succeed by meeting those goals. And that's really what essentially I see a career ladder being, because if we were to just say, okay, I'm going to go from staff sonographer to work leader to manager, well, we know we can have a staff of about 30 people, but there's really only one manager. So it's a very narrow career ladder. And so you have to understand that's a pitfall too. So that's why it's important that if you have that self driving nature and internal motivation, you'll find things to do. And that's where volunteerism comes into play, when we have all of our societies that we can work with and meet other like-minded people.
Yeah, and I loved that about your talk because when you volunteered, then things just started opening up for you, right? Opportunities to kind of expand your skill set, or your specialty was needed in certain areas to help develop and promote different areas of your field. And so I love that because that didn't come about until you started volunteering, until you started getting involved in something, right? And
Right.
I think that's one reason why I've just kind of fallen in love with SDMS again. After doing this for 30 years and kind of getting burnt out and switching to a different modality and then coming back to the modality I love and different things, having all those modalities gives me a better understanding of how things function and work. And I think of things differently because I've had all those specialties. I think all that education has just enhanced me, right? And enhanced different things. But it wasn't until I got back involved and plugged in uh, to STMS or some volunteer opportunities that I learned of the advanced practice sonographer, that I learned of this opportunity or that opportunity, or talking or sharing information, right? Because everybody has something that they're really good at, that is just really their niche. And I loved how that opened up so many more opportunities for you. Can you tell us some of the benefits and some of the things that volunteering opened up for you?
Well, I think first off, I have met some of the most intelligent people on the planet when it comes to echo and leadership and quality. And I just love how steadfast everyone is. It's great to meet people who have a vision, and that's just, they're so incredibly inspiring. And, it starts off small. I think I started speaking at our local society, and it was simply the same things that I've talked about, where why didn't we learn this in adult echo? And I remember I just gave a coronary talk, not even realizing, when you're first learning echo that you can see your coronary arteries. And here went to peds and went, oh my gosh, they were right there. So just,
Right.
it sounds so silly now to think about it that way, but then how to optimize your pictures and how to look for it. And slowly I liked the way that felt. It felt good. I liked teaching and I liked sharing the information, right? If I learned something new, the first thing I wanted to do was share it to someone else. And SDMS was the first society, national society, to give me that opportunity to teach and to speak. And so I took that coronary talk and took it to the national stage when I had gone out to Dallas, Texas. That was my first SDMS so long ago. And with that, it just started to grow. Met a couple people here and there. My first ASC that I had gone to was after I'd won a travel grant. I was the only person there that I knew. There were almost 2,000 people kind of wandered about. And if anyone's ever gone to this ASC, it was the one where they lost power in National Harbor. So here I was with no friends, no food because all the restaurants are closed,
Oh, no.
but still navigating through the conference, but then learning about a global mission that they had. I thought this is really neat. And that was also the same one where the keynote speaker was an astronaut who had gone up into space and had used an ultrasound machine that was developed by Dr. Jim Thomas out at Cleveland Clinic. And it just felt like a huge full circle moment because that was why I had gone into engineering in the first place, was to hopefully work at NASA. Since then, I diverged in which way I'd gone, but I thought, wow, there might be a place for me. And it wasn't necessarily a place with engineering, it was a place with thought and what my background would might become helpful in this. And so I applied for that first travel grant and went to ASE, learned about it. So I applied to be part of that global mission and was selected. And from then, it just, every time I'd see, here's an opportunity to do something, I'd sign up. And before I knew it, I would get invitations to do something. And it just started to grow and grow. And since then, I've done multiple outreach missions. I've gone to Rwanda, I went to India, and I've actually gone out to an indigenous populations reservation out in Scottsdale, Arizona, up in the mountains. And it was just a really neat experience. And with that, being involved in so many societies, I was able to connect with so many people. And when they know what your passion is, teaching, imaging, and growing the profession, that's really what's needed. And so I've worked with Society of Pediatric Echo, American Society of Echo, spoken at local conferences in Chicago and in Minneapolis. Recently, I'm involved with the ACC. There's a new allied health work group where, physicians talk a lot about cardiology topics, but in the end, they also need their sonographers to understand how will this work for our entire profession. You can't have cardiology without echo. They can try, but they'll still need the echo. So, so
Right.
having allied health workers represented everywhere is really, really important. So I think it just grows. I've anything basically, you know what? Don't say no. Don't say no. You want to say no, you're tired, but when a really neat opportunity comes its way, don't say no. Give it a try. Talk to someone who's done it, and I can promise you they will have come in with the same insecurities and doubts and concerns, and they come out going, okay, I did that. I tackled it, and I had a friend that helped me out with it. So be that one person you only know in a conference of 2,000 people. It's
Yeah.
okay.
It is okay, and I think it's part of being in a room with people that are smarter than you, right? I think
Right.
um when you're in a room with people smarter, there is a feeling of insecurity, like, oh, do I belong here? Do I know enough? Like there is, but realizing we're all human. We all come from the same humanity base, right? Where they feel that way maybe about your topic that you're uh experienced about. And so I think giving that side of humanity to everyone, and I think that that brings humility into us, right? Like
Right.
we're humble to be a part of such society or smart people, right? And remembering that we can learn from anyone and everyone, right? Um, I think that's an amazing part of it. I also like this pillar image that you have with you have pillars of volunteerism, education, research, and leadership. And then the
Mhm.
next slide, you have volunteerism on the bottom, like it's your base, it's your foundation, and education, research, and leadership extend from that. Can you
Mhm.
speak to that image as well?
Well, a lot of times we hear, hey, and you should maybe try this. We should maybe do this in our lab. Well, and they're not going to pay us any more money. They're not going to pay us any more to do that. And that gets tough to someone who's really trying to do something different. And when they talk about service to the different organizations, they talk about do you show volunteerism? Do you show that you've educated? Are you part of research? Have you had leadership experience? But in the end, volunteerism isn't a pillar, it's the foundation. All of that is all self-directed. It's what do you want to do? You won't get paid more. I mean, we know that money is finite in healthcare, and we also know that the first thing that gets cut for sonography departments is education and funds for other things. So
Right.
understanding that it's all volunteering. You're giving time, but you're giving time for yourself because at the end of the day, at the end of the week, at the end of the year, you're part of a profession where you've actually provided to now. You're helping that profession grow. You're helping your lab grow and the sonographers around you. You're not just showing up, you're actually doing something.
Yeah, I have experienced this even in my own personal life. I chose to be a single mom with three kids, and they were young, 10, 6, and 4, and that brought a lot of struggle and opportunity to grow in a lot of different ways. But I remember being a part of a faith group and at the time, and they encouraged volunteerism. And so I volunteered at a woman's shelter. And oh my God, I had no idea what that was going to bring to me, right? It provided like perspective, like, oh, okay, I'm not as bad off as I thought I was, right? Um, it could be worse, right? Um, but it also brought opportunity, people needed certain skills that I realized, oh, I have that skill because of this situation that I've found myself in. And now I can teach some of those skills. And so um it started with volunteerism, right?
Mhm.
And I just was became so much more grateful that my
Mhm.
world expanded in that way. So I
Right.
found that personally, and then I thought, oh, this is going to happen for me professionally too,
Mhm.
right? So excuse me. So, I too think volunteerism just in any area, your personal life, volunteer to help a race in your community or volunteer with the people who build houses for underprivileged people. Uh, what's that? Humanity.
Oh,
What's
yeah, Habitat for
Habitat for
Humanity.
Humanity. Thank you.
Right,
Um,
right.
or and you can do it in your professional life, SDMS, right?
Mhm.
And I think part of ultrasound is always growing. Um,
Mhm.
I mentioned this on my Instagram post. It's personal development, right? And I think if we're not growing, we're dying.
Right,
And
right.
I think volunteerism will definitely expand your borders, will help you grow, and give you opportunities you never even dreamed of having.
Right. And, we see a lot of people, we know, I kind of keep my eye on the sonography groups that talk on Facebook and on social media. And, you'll see a lot of posts. Okay, I have a job offer. It's 312s. I have a job offer. I have this. I have this. And I remember one post in particular where it was 5 days a week, 7:30 to 4. Or should I do this 312s or 410s, something like that. And I actually wrote and I said, do the 5 days. Do the 5 days, have the structure, show your children the structure, show them that you do have to work. You do have to do some certain things. I think right now we're caught in this world of, I want to be there for my kids and my family. And just because you work a 5-day work week doesn't mean you aren't. And in actuality, the kids see you working, the kids see you getting up, the kids know what their structure is. And it's actually very beneficial to them because they also become self-sufficient in many ways. And I say this from someone who my children were 5, 6, and 7 when I went back to work. So they weren't old. And I didn't wait till they got out of school, but we all worked together. They showed me how they could come home on the bus, not when they were 5, but when they were a little bit
Right,
older. They showed
right.
me when they grew up, and I said, okay, they found ways to get to their practices. They became self-sufficient in certain ways. I would be throwing chicken nuggets at them in the back of the seat when I had to get them places. So, we all do that. But it's understanding that there is a way to have that balance. And on top of it, when you volunteer, it's a mindset, it
Yeah.
sets you up at home and the kids see it, your family sees it, that you're not only doing the 9 to 5, or in this case, 7:30 to 4, you're actually doing that and just doing a little bit extra because when they graduate high school, when they're off in college, which is a very short time, then you have set yourself up to grow even more. And so ever since my kids have gone to college, things have just, you know, ballooned even more so. All of the things that I do, it's only because I set up that foundation early on. But let them see you work. Let them see you study because they'll start to do the same too.
Yeah, I totally agree with that. My phrase with that when I was raising my kids are your kids will do what you do, not what you say. You
Mhm.
know. And so if
Yeah.
they see mom being independent and studying and expanding her right, they'll do the same. You know,
Hmm.
they will
Hmm.
do the same. And my kids are older now, young adults, and I see them doing the same things. Like I never
Hmm.
said, "Hey, you need to exercise every day or work out," but we talk about it all the time. How was your,
Yeah.
lift session today or whatever, how much weight did you lift today or where's your PR or, you know, um, and it wasn't because I said, "Oh, you need to do this." It was because they saw that I did that, right? I
Right.
remember choosing my battles, and I thought, I'm not going to make my kids make their bed, right? Like, I just don't have that capacity in me, even though I was taught that as a kid, right?
Right.
And so I did it every day. I make my bed. And to this day, now when they were younger, they didn't, but I didn't choose that battle to fight, right? And now that they're older, it's funny. They all at one point in time in their life, Mom, I make my bed every day. They tell me that. And I'm like, why are you telling me this? Only because they saw me do it, right?
Yeah.
And I just think it's so funny that is one of the best gifts you can give anyone, your colleagues, your children, anyone around you is you lead by example. And so
Exactly.
I commend you for that because that's exactly a lesson that I learned same way. Talk about the 7 pillars of self-care because I think if you're in the medical field, you're bound to come up against this, right?
Right. Right.
So talk to us about that.
This all kind of started with a little bit more with COVID and just understanding the burnout that was there. I mean, really, those of us in Echo, especially, were thrust into this world because of the cardiac effects of COVID. And then we're going into rooms. ASE came out with guidelines very quickly as to how to protect yourself, how to protect your staff. But, you know, there's a checklist as to what it is that they wanted you to look at. They said that make sure you are, um, how to stay safe against COVID, make sure that you are getting your vaccine, that, have your health screens done, make sure you're doing physical activity, make sure you're eating healthy, avoid risks, don't go into a super big COVID party, right? We saw
Right,
a few of those
right.
on the news. Shower, have good hygiene, and,
Wash
be aware of all the dangers, right? And those are the 7 pillars. But really, we know eat well, we know work out, we know be safe. But if the core, which is our mental health and our mental well-being, isn't there, then none of the rest will happen. So I don't think of it as 7 pillars, but I think of it as like a flower, where in the center, where all the pollen is that's your mental well-being. And then from that come the petals of your knowledge and your physical activity, your healthy eating, and all of the things you need to do. But you first have to be in that place where you want to do it. And this is so important for those of us in healthcare in general, because we are used to taking care of everybody else. There's, uh, you know, not too much of a spoiler, and this may date your podcast. I apologize.
No,
The latest issue of The Pit will actually show something like that, where someone is having a mental breakdown and they're told, just get over it.
right,
And that doesn't really happen. It can't happen. And you see that and you go, wait a minute, there's something I have to take care of. And, we see the new generation coming in and we're like, oh, they're so self-centered. All they care about is themselves and blah, blah, blah. And remember when we were growing up, now this is going to date us,
right.
but we didn't get to fly too much. We weren't just hopping on a plane going places. So
Right,
when they gave that safety briefing, we were watching, we were making sure. And what do they say? Put the mask on yourself first, moms, then put it on your kids. And so now these kids have grown up seeing that infographic, the one where you put the mask on yourself first and then you take care of everyone else. So when I thought of it that way, I'm like, no, this generation isn't self-centered. It's not a me generation. They're doing exactly what we taught them to do.
right,
And in the end, that's where your core is. That's how your mental health begins, is by taking care of yourself. And if anything, COVID taught us that, right? That we had to take care of ourselves, we had to take care of our families. And when someone else was sick, yes, we take care of them, but we need to make sure that the people around us, we're not wiping out our entire echo lab with COVID. We need to make
right,
sure that it's all good, but you have to step back and ask for help, step back and get help if needed, and step back. And if one morning you wake up and you're like, not today, call in, call
yeah,
in sick. It's okay. Remember, you don't have to tell why you're calling in. You
right.
just have to say, I'm not coming into work today,
Mental
and
health.
take that day. Yeah. Yeah.
Yeah,
Take that time for yourself. So, yes, mental health and well-being is so important. And that's where all these 7 pillars, where you can take care of yourself, happen. But it's got to come from you.
right. Yeah, recently I saw presentation on EAP, employment, what do they call that? EAP. Equal,
EHP?
where there's counseling for you
Oh, yeah.
work.
Yeah. I don't know what the letters stand for. I think ours is
Employee
called
Assistance
something along those
Program,
lines.
EAP,
Okay.
Employee Assistance. And I don't think we need to wait till there's a problem. I think
Right.
having a counselor through different parts of your life and through different times of your life is important. And so maybe you don't go every week or twice a month or whatever, but maybe you just know them and have a history with them enough that if something does arise, you can tap in, right?
Hmm.
To
Hmm.
having someone to give you a different perspective because sometimes you're not the one with all the answers, right? Like
Right.
I attend a few other meetings, community meetings, and I think, man, if I didn't show up and hear somebody else's perspective on this, I would have been stuck in my own head and I would have just destroyed this opportunity or destroyed this mindset around this person or whatever, right? And I think it all happens in our head, right? And so
Right.
I think controlling our thoughts and choosing our thoughts, right? One of my mentors says, bring the joy. And he says that the power plant doesn't have power, it creates the power, right? And so we have to create the joy in our life. We're responsible for that and
Mm.
not to rely on a work or outcomes or coworkers to fill that bucket, but make that bucket our own responsibility.
Right. And
So,
there are some things that are out of our control for sure. And, it may not be in all hospitals, but there is something called a code lavender. So we have code blues, code pinks, but there is something called a code lavender where once called, they actually will have mental health professionals contact you. It can be something as simple as going into a stress relief room or the code lavender room where it's just a relaxing environment, a massage chair. Sometimes it'll be a counselor you can talk to. And I know that this is available for our physicians, especially when they experience a traumatic event, in our ICU or with a child or with a patient, that they can call Code Lavender. It's just not, it's not blast over the over
yeah,
the intercom the way
intercom,
Code Blues
right?
are. But
Yeah,
we can call and get help. We've had a couple instances in the Echo Lab where something triggered a patient, or triggered our sonographer, and we called Code Lavender, and they came and kind of helped our sonographer kind of maneuver through that day and followed up with them later. Because if you don't have that, then what happens? They say, I'm fine, I'm fine, I'm fine. And then the next morning it hits. And
right.
the next morning they don't come in, and maybe they don't come in for 2, 3 days. So it's just a downward spiral. So it's trying to take care. So we know that some things you can't help. There are those feelings, and it is a deep, dark place you go into no matter what circumstances you're in. So knowing to ask for help is very important too.
Absolutely. Absolutely. I learned of Code Lavender at SDMS. I haven't been a part of a hospital that has it, but I've brought the idea to several different hospitals as a traveler. And so I'm hoping to spread that idea um,
Hmm.
because I do think it's part of taking care of ourselves and
Right.
asking for help.
Yeah.
Um, so. Yeah, and I think it should get rid of the shame around asking for help, right? I'm
Right.
hoping
Right.
to minimize that as much as possible. So, yeah.
Mm.
Well, thank you so much. I know that all these opportunities brought the opportunity for you to help create um, the ASC guidelines for pediatric echo. Also gave you opportunity to go to mission on several mission trips and different things like that. And so it definitely volunteer can really broaden your perspective and your opportunities quite a bit. So
Yes, definitely.
thanks for stepping forward and offering all your skills and experience and your strength to us to give us hope. Um, we certainly appreciate it. And thanks for sharing um, about our career optimization of our images and our career path. I appreciate
Well,
it.
thank you. Thank you so much, Debbie, for having me. I think that we're in a fun field. I think we have to find the joy in it. It's very easy to say, grumble, grumble about the day. But I think in the end, if you just stop and enjoy the images that you see and what you can do and what you're really doing, you'll realize how important our job is. And we're not just picture takers, that we're actually able to take diagnostic images to help our patients. So, kudos to everyone else out there too. They're all doing a great job.
Thank you. Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.